Good afternoon. I am Tanya Ask, and I have the pleasure of being your MC today and tomorrow morning. I am on the Planning Committee for the Healthcare Forum, and I'd like to just say a couple of words about the forum. The forum truly is a body of individuals interested in healthcare in Montana. We represent a broad spectrum of interests. We're all consumers. We've got individuals representing facilities, individuals representing medical professionals, individuals representing employers, insurers, individuals representing consumer groups. So it is very important that we recognize who is a part of this particular forum. I am currently on the board of CMC Missoula, Inc. I am the past chairman of the Montana Comprehensive Health Association. So that's how I got into this particular activity. I would like to just briefly, before we get started, I've got some logistics, but I want to recognize the Planning Committee, and I do see several members of the Planning Committee. These are the individuals who gave of their time and effort in order to put this conference together. Mike Foster, representing SLC. Barbara Schneeman, representing Riverstone Health. Dick Brown, representing the Montana Hospital Association. I don't see Jean Branscombe here yet. She may be here a little bit later, representing the Montana Medical Association. Jean. Webb Brown, representing the Montana Chamber. And as I see other people, I will mention them as we go through this. But the Planning Committee has done an awful lot of work, and thank you very much for your efforts. We have three very important announcements from our congressional delegation. Our congressional delegation across the aisle has always been very supportive of the Montana Healthcare Forum. Every single member has been extremely interested in the discussions that we have, the types of issues that we bring forward, and we have had some very creative solutions come out of this particular forum. I know our congressional delegation appreciates that, and they have been most supportive. So with that, we are going to first view two videos, and the first one will be from Senator Tester and then Senator Daines.
Greetings from the United States Senate, and thank you for inviting me to share a few words. I want to thank Webb Brown and the Montana Chamber of Commerce and the many sponsors for facilitating such an important and educational event. The theme of this conference is Building a Healthier Montana, which is a goal we've shared ever since I stepped foot in the Montana legislature, which is why earlier this year I was pleased to partner with the Montana Hospital Association to host the first ever Rural Health Summit to get feedback from folks on the front lines of healthcare delivery. It's also why I was pleased to work with the Montana Chamber of Commerce to pass the PACE Act to make sure states have the right to set the size of the marketplace for different employers. I also want to thank you for your support of the Medicaid expansion. Because of Governor Bullock's leadership and his partners in the legislature, 70,000 more Montanans have access to health care. While we've had some great successes in health care recently, there have also been some challenges. Health insurance rates continue to rise, and the new political landscape is putting coverage of tens of thousands of Montanans at risk. Despite the uncertainty, it is my hope that we can commit to making sure that all Montanans have access to quality, affordable health care. Because when Montana families are healthy, our economy and our businesses succeed. Together, I hope we can expand telemedicine initiatives, attract and retain more doctors, nurses, and healthcare professionals, especially in rural areas, and expand mental health services throughout our state. I know our current system is far from perfect, and there's a lot of uncertainty about its future, but we've made a lot of important gains since passing the Affordable Care Act. We've extended coverage to thousands of Montanans who didn't have access to health care before. The uninsured rate in our state has dropped from 21% in 2013 to 7% today. Kids can stay on their parents' plan until they're 26, and folks can't be denied coverage because of a pre-existing condition. This is progress, And I think we can all agree that we can't go back to the old system where folks couldn't afford to get sick. It is clear that Congress will be tackling this issue next year, and I will keep an open mind to suggestions from my colleagues on both sides of the aisle. It's going to take Republicans and Democrats working together to ensure Montana families and employers have the health care system that's affordable and accessible. So please, feel free to reach out to me and my staff with any ideas. I truly believe we can build a healthier Montana together.
Well, a warm welcome to the Montana Healthcare Forum. As your United States Senator, it's an honor to work alongside hardworking community leaders like yourselves to make Montana a better place to live and to work. And as you experience firsthand every day, working to ensure Montanans have affordable and reliable health care, it's an increasingly challenging task. When I addressed this forum just last year, I spoke about drastic healthcare insurance rate increases between 22 and 34%. I was deeply concerned and continue to be about the impact on Montanans, and with very good reason. Under Obamacare, the rate of increases have continued to go up. While the national average insurance rate hike is 25% for next year, Montana's rates will increase an average of 27 to 58%. I've said for years that Obamacare isn't affordable and it needs to be replaced with state-driven solutions that put patients at the center of the healthcare equation. And with the new administration taking the helm in January, now is the opportunity to consider solutions that reflect Montanans' common sense. I'm working to find healthcare solutions that help strengthen our workforce and protect small businesses, as well as utilizing increasing technology to ensure that people in rural Montana get the healthcare they need. And this is why I co-sponsored the Connect for Health Act, which would increase access to telehealth and remote monitoring health technology for Medicare beneficiaries. Because when it comes to improving health care, we need to ensure that invisible illnesses, as well as the visible ones, get treated in a timely manner, and that patients have access to the resources they need. And that's why I'm also working to improve mental health care for veterans and others in need, and helped increase vital resources across our state for mental health care and mental health care counseling. I also strongly supported the Comprehensive Addiction Recovery Act to combat opioid and methamphetamine abuse. I'm glad that this legislation was swiftly signed into law, and I'm looking forward to seeing the positive results it will bring to Montana. We have a lot of work to do to fix healthcare in our country and make it work for all Montanans. And our goal is to solve problems, to find solutions, and to get some results. I've always said that the best solutions don't come from Washington, D.C. They come from hardworking Montanans like you, like the folks in this room. If there's anything that I can do to better serve you, or if you have comments, concerns, or questions, if you'd like to share those, please don't hesitate to contact one of my offices across Montana or my office in Washington, D.C. Thank you so very much, and God bless.
And with that reference to contact offices, if you have questions, I would like to make sure everyone in the room knows who the two representatives are from Senator Tester and Senator Daines' office. Deb Franzen, would you please stand? And Bill Hilshey, would you please stand? So if you have any further questions of the senators' offices, you may see those two individuals who are going to be listening to our discussion today. The third representative of our congressional delegation is Congressman Ryan Zinke, and to represent him is Alex Strahan.
Thank you, Tanya. Like Tanya said, my name is Alex Strahan. I'm the Eastern District Director for the Congressman. So I work out of his Billings office over here in the Granite Tower on the 9th floor. So I know it's in our letter, but just to reiterate, our open door policy. So if there's ever anything we can do or assist with, please feel free to stop by or give me a call. I do have a letter here from the Congressman I'll read now. Dear attendees, thank you for investing the time and effort to attend this year's Montana Healthcare Forum, and a special thanks to the Montana Chamber of Commerce for the work you have done in putting this event together. Although I cannot be there in person, I truly appreciate your invitation to speak. As the 114th Congress comes to a close, healthcare remains a central issue as we move into 2017. I remain fully committed to supporting healthcare reforms that are patient-centric and fit Montana's rural and frontier needs. The path before us is going to require serious work, but if we approach this in a cooperative manner, we will be successful. Since coming to Congress, I assembled a healthcare advisory committee. These Montanans represent every facet of the healthcare community. Their input and guidance has been incredibly valuable as we work towards real solutions to problems we face. Too often, Washington has handed down mandates and regulations that have forced our providers into an excessive regulatory environment that is more focused on compliance rather than actual care. Even worse, these bureaucrats tend to forget our rural challenges. That is why I've consistently advocated for increased flexibility and stable reimbursement models so patients, businesses, and providers can operate in a predictable manner. As we enter a new administration, a new Congress, I will continue to rely on Montanans' insights to craft policies that encourage innovation, efficiency, and most importantly, quality care. Thank you again for participating in this forum. My office welcomes and encourages your input. If there's anything me or my staff can do to help, please don't hesitate to ask. Sincerely, your Congressman, Ryan Zinke.
Thank you, Alex. There are two more dignitaries in the audience today I would like to recognize just very quickly. The Office of the State Auditor and Commissioner of Insurance also, of course, has other things that it does, securities and some other things, but the insurance aspect is one that has led this office to be very active in the healthcare forum and very active in health policy issues. We have with us today State Auditor and Commissioner of Insurance, Monica Lindeen. Would you please stand? We also have with us today State Auditor and Commissioner of Insurance-elect Matt Rosendale. Please stand. These two individuals are highly committed to the state of Montana, and their attendance here is proof of that. So since they are here, I know they want to hear from you. They may have questions. Please make that opportunity available. Thank you.